If you have diabetes, your blood sugar may be damaging your body even when your numbers don't look that high. Many people believe danger only comes from very high glucose readings. But in reality, that is not the full story. The real danger is not just how high your blood sugar goes, it is how fast it rises after you eat. If you are living with diabetes, you probably check your blood sugar regularly. You may look at your fasting numbers in the morning. Those rapid rises are called blood sugar spikes. And this is exactly where something called the glycemic index becomes very important. Hello, and thank you for being here. My name is Dr. Ken. I am an endocrinologist specializing in diabetes care. You may also check your blood sugar after meals. Many of my patients ask me the same important question. Doctor, why does my blood sugar rise so fast after certain meals, even when I don't eat that much? The answer often comes down to one key concept, the glycemic index. In this video, I will explain what the glycemic index is and why it matters so much for people with diabetes, and which common American foods have a low glycemic index. By the end of this video, you will better understand how food affects your blood sugar and how to protect your health over the long term. Now we come to the first question. What is the glycemic index? The glycemic index, often called GI, is a way to measure how fast a food raises your blood sugar after you eat it. The glycemic index is measured on a scale from 0 to 100. Foods with a low glycemic index raise blood sugar slowly and steadily. Foods with a high glycemic index cause blood sugar to rise quickly and sharply. We generally classify foods into three groups. Low GI foods are 55 or less. Medium GI foods are between 56 and 69. High GI foods are 70 or higher. Here is an easy way to think about it. Low GI foods are like walking up a gentle hill. Your blood sugar rises slowly and stays more stable. High GI foods are like falling off a steep cliff. Your blood sugar shoots up very fast. For people with diabetes, avoiding those steep cliffs is extremely important. Next, we will come to the second question. Why glycemic index matters? Many people focus only on fasting blood sugar. While fasting numbers are important, they do not tell the whole story. From a medical perspective, it's far more complex than it appears. Rapid blood sugar spikes after meals are often more damaging than slightly elevated fasting glucose. It's crucial to understand why. When blood sugar rises too fast and too high, it damages the small blood vessels in the body. These include the blood vessels in the eyes, the kidneys, and the nerves. Frequent spikes also increase inflammation, force the pancreas to release large amounts of insulin and hormone and cause the condition that worsen insulin resistance over time. When this happens repeatedly, type 2 diabetes progresses faster. Over the years, these spikes increase the risk of heart disease, stroke, kidney failure, vision loss, and nerve damage. You may not feel these spikes happening. They are often silent, but your blood vessels feel them every single time. Many people are taught to count carbohydrates. Carb counting can be helpful, but it is not enough on its own. Not all carbohydrates affect blood sugar the same way. Two foods may contain the same number of carbs, but one may cause a sharp spike, while the other raises blood sugar slowly. This is why the quality of carbohydrates matters, not just the quantity. The glycemic index helps you choose foods that keep blood sugar more stable. You can absolutely reduce insulin resistance and manage diabetes without extreme dieting or feeling deprived. Now let's talk about low glycemic index foods that are commonly eaten in the United States. Non-starchy vegetables are some of the best choices. These include spinach, broccoli, kale, zucchini, bell peppers, and cauliflower. They barely raise blood sugar and help improve insulin sensitivity. Beans and legumes are also excellent options. Lentils, black beans, chickpeas, and kidney beans are great sources of fiber and protein. Help release glucose slowly and help reduce blood sugar spikes after meals. Healthy fats have a glycemic index of 0. Foods like avocado, olive oil, nuts, and seeds slow digestion and help keep blood sugar stable. Talk to your doctor to see if this is right for you. When choosing fruit, low GI fruits are better than fruit juice. Berries, apples with the skin, and pears raise blood sugar much more slowly than juice or dried fruit. Protein-rich foods are also very important. Fish, chicken, eggs, and plain Greek yogurt help stabilize blood sugar and protect muscle mass. When choosing grains, steel-cut oats, quinoa, and barley are excellent options. These are better options than white bread, bagels, or sugary breakfast cereals. Foods that cause rapid glucose spikes include soda and sweetened drinks, white bread and bagels, French fries, desserts, and many baked goods. Even eating these foods occasionally can contribute to long-term complications if they cause frequent blood sugar spikes. You do not need to be perfect. Diabetes management is about consistency, not strict rules. You need to think about combining carbohydrates with protein and healthy fats. Eat fiber-rich foods first during meals. Avoid liquid sugars whenever possible.
Eat slowly and pay attention to portion sizes. Small changes done consistently can make a very big difference.
Managing diabetes is not about perfection. It is about control and consistency. Every time you prevent a blood sugar spike, you protect your eyes, your kidneys, your nerves, and your heart. Understanding the glycemic index gives you that control, and control leads to better health. My goal is to help you understand your body, not just your numbers. If you're living with diabetes, you're not alone. Share your experience in the comments below. If you want more simple, practical explanations about diabetes, please like, hit subscribe, and turn on notifications. I'm Dr. Ken, Diabetes Care. Thank you for watching.